dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and today we're going to be talking about skincare and what you can do and how you can help your skin be healthy and well. And my guest is Sonia Biddle. She is an esthetician and a skincare specialist and a makeup artist. Welcome, Sonia.
Thank you.
Let's talk about what is an esthetician.
So an esthetician is a skincare therapist, somebody who is trained and specialized in skin health, skin well-being, different skin conditions.
What is the training that you go through to become an esthetician?
Training typically, it varies state to state with however many hours that particular state requires to become licensed. In school, you are trained and study anatomy and physiology of the skin, sanitation guidelines, skincare conditions, and skincare types.
And how early do you begin to take care of people and help them with the skin?
So typically around 12 years old, you start to see, parents bring their children in, their daughters in for any hormonal breakout that they might be having.
And what are the types of things that you do with skincare for adolescents?
Facials, usually deep pore facials. We want to set them up on a good skincare routine at home so that they are able to take care of their skin.
Can you describe what a facial is like so that people understand it?
Sure. So we offer a variety of facials, from deep pore cleansing facials to more skin tightening, skin rejuvenating, brightening facials. So it really would depend on the type of facial that you're having done, but we would cleanse, analyze, assess your skin, exfoliate with some sort of exfoliant, whether it be an enzyme, anywhere to a chemical peel, to a dermaplaning.
What's dermaplaning?
Dermaplaning is a exfoliation technique using a tool. So you exfoliate, but at the same time, you're able to remove the vellus hair.
Which means what?
The baby fine hair
Okay.
that you have, which is very different than the hair that you might have on your legs or on your head.
Okay.
So by removing that vellus hair and exfoliating, your products are going to penetrate much better. And we usually like to do a peel of some sort over it.
Okay, and what is a peel?
So there's a few different types of chemical peels or enzyme fruit acid peels. A chemical peel could be anything from glycolic acid to mandelic acid to salicylic, to help break down the dead skin and reveal new skin.
And is this something that you do with adolescents?
It depends on the situation, the severity of what they might have going on with their skin.
And then do you teach them how to take care of their skin?
Absolutely. So that's another thing that estheticians do, is we're here to guide you with your skincare questions, concerns, any products that you might be interested in, and to set you up on a skincare routine, because you can come in, have skincare treatments, which are great for healthy, beautiful, glowing skin, but you really want to make sure that you're using those products at home to maintain what you have done in the spa or office.
Mm-hmm. And so from a relationship of a routine, that involves cleansing. So is it just soap and water, or does soap and water work, or are there other things that would be better to use?
You definitely want to be using a cleanser that's formulated for your skin.
Skin type?
Skin type, skin
And what are the
condition.
different skin types?
Normal, oily, combination, mature, sensitive.
And the skin conditions that you are assessing?
It could be anything from maybe somebody has rosacea to hyperpigmentation, which are brown, age spots,
Yes.
to acne.
Okay. So you assess skin, And you start as early as adolescence to be able to help with breakouts and things like that and educate them as to what they need to do to have healthy and clear skin down the years of their life. So from adolescence, then you go through the adult years.
Yes.
Okay, and what are you seeing and what are you treating?
So as we age, our skin changes.
Yes.
We start to become a little bit drier. We're not producing as much collagen.
And what is collagen?
Collagen is basically what keeps our skin supple, plump. Yep. So as we age, that becomes depleted. So we want to make sure we're putting that back into the skin or performing treatments that are going to help stimulate collagen production, that are going to help hydrate our skin, and be using products at home that are going to do that as well.
Okay, so are there differences in the seasons related to how we take care of our skin and what we can notice about our skin that should draw our attention to what we need to do?
Yeah, so in the summertime, you're out in the sun more, so your skin tends to become a little bit drier. I feel like our skin is always dry, especially in this area anyways, but our skin will become more dry. You're in the sun, so you're getting a lot more sun, so you might have some more sun damage. So it's nice to do in the fall is do a good cleansing facial, a good hydrating, brightening treatment. In the winter, it's going to be dry again, maybe a little bit more dehydrated, so do like a real nice hydrating treatment.
Can people give themselves their own facials?
Well, I wouldn't necessarily recommend going home and doing any extractions or anything like that.
Okay, and
but
extractions are?
Extractions are removing any maybe blackheads, things like that.
Because if people do that, they could put too much pressure and actually
Traumatize the skin.
Yes,
there's a certain technique and way to do it, and when you come in and have a facial, we prep your skin to do all of that.
To open it up so that the pores are more open so that you can get easy access and be able to take them out easily.
Yep. Yeah, that is one part of the facial. So, but definitely, so you can't do facials at home in the sense of doing things like that, but you definitely want to make sure you're using products at home and you have a skincare routine that's going to keep your skin healthy.
And that skincare routine would include cleansing and then what else?
Cleansing, any serums that you might need.
And what do those serums do?
It depends on the type of serum that you get.
Okay.
So we have a variety of serums, from vitamin C serums to hyaluronic acid serums.
And what do each of them do? What is the difference?
So like a vitamin C serum or an antioxidant,
yes,
it's going to help fight free radical damage.
Okay. And the
It's
free
gonna
radicals are coming from the environment.
Environmental stressors, tobacco use, air pollution, even like the foods that you eat will trigger that as well. So you want to be using some sort of antioxidant that's going to help fight that free radical damage and help brighten your skin and help stimulate collagen.
Okay.
Then we have hyaluronic acid, which is very hydrating. It helps replenish your skin's own hyaluronic acid levels, which we naturally produce.
Okay.
And then we have serums with maybe salicylic acid in them that are going to help somebody that has acne.
Mm-hmm. And the aging skin, is there a different way of taking care of aging skin?
Yes, definitely want to be using some sort of vitamin C serum on your skin because that's going to stimulate the collagen. And then hydrate, a lot of hydrating.
And how do we
And
hydrate?
sunscreen, of course, sunscreen.
Sunscreen always. So how do you hydrate?
With moisturizers or with serums.
Okay.
I prefer to use a serum that has a hyaluronic acid and then a really good moisturizer over that.
Mm-hmm. And so the skin, of course, the face is very reflective, and people have more confidence when their skin is clear and, and they're feeling good about them. What are the greatest challenges that you have related to people that may have certain diagnoses or diseases that they're working with? How do you help them in their skin?
I guess I would say I just want them to feel comfortable enough to be able to come in and talk with me and feel confident that I can help them and guide them to what it is that they need to use on their skin. And if just because you might be having some sort of skin condition going on at the moment doesn't mean it's going to last forever. So there are definitely things that we can put you on that are going to help with whatever it is that is going on at the time.
So do people You do an analysis of their skin, and then do you make recommendations as to what would be the treatment plan that would benefit their skin to help them resolve any issues that they're having?
Absolutely, yeah. They can come in and we analyze their skin. We want to set them up on a treatment plan and a home care plan to get them to where they want to be.
So when it comes, so product does play an important part as far as home care is concerned.
Yes.
Okay. Can there ever be too much product or the wrong product to use that could actually cause a difficulty? I know some people like to make their own products or do their own things.
Yeah.
What would you say about that?
I'm not a huge fan of those because it tends to be a lot of people that younger generation that might have breakout and they start seeing things online and putting coconut oil on their face, and as much as I love that, it's not always the best thing for you. So I'd rather somebody come to see a professional who's trained in skin conditions and skin care products and have an esthetician guide you in the right direction for what it is that you need to use on your skin, rather than make something at home that you don't know what the side effects might be, and at the moment it might feel good, but with continued use it could maybe have an adverse reaction.
I see. Now, are there medical estheticians as well as spa-related estheticians?
Yes.
What are the differences?
So I myself am a master esthetician.
And what does that mean?
I'm just training, a little bit more training, in-depth training on certain procedures and treatments than somebody who maybe does lesser hours.
Okay.
They still have a lot of training, but it won't be as in-depth.
Okay. And the medical esthetician is one that works in the medical field? Are they usually working with a dermatologist?
Typically, you find them working in a medical office, a dermatologist, a plastic surgeon.
And what will they do differently than what you will do in a spa setting?
They might assist the dermatologist or plastic surgeon, or they might offer some treatments that you wouldn't find in a spa, more so than...
Related to medically oriented treatments, like what?
It really depends, because you can, laser hair removal, for instance,
Okay.
is something
That'd be a good
that they would
example.
be doing.
Okay.
But then you could also, you can perform some of those treatments in spa. It just depends on the licensing and if you have a medical director. And
Okay. And a spa setting, for those that don't understand that, can you describe it for people?
it's relaxing.
Yeah.
But
But they're safe and
especially,
secure.
oh, absolutely, especially at Cassandra Salon and Spa, it's a results-oriented, driven spa. We want to help you. It's not just kind of fluff and buff,
Okay.
but if we still have that nice coziness where you come in and you're getting massaged and it's relaxing. It's not just all medical. You know what I mean?
As far as the esthetician, when they come in to see you, is that also relaxing? What is it like for a person who's never had a facial? What would they experience working with you?
Working with myself?
Yes.
An esthetician? Another esthetician?
Yes.
Well, I hope that I would be able to educate them. I would hope that we would work off of each other, because this is constantly changing, the industry, so I would want to learn from them, as I would hope they would want to learn from me.
The client, and you're talking about working
Oh,
as
I'm
a
sorry.
team?
I thought you meant an esthetician
No, what I'm
as
really
a client.
getting at is to help a potential client who's never had a facial before and been to an esthetician, to be able to describe the setting that they will go into so that they know that it's a safe setting and what it's like.
So you'll come in, we'll bring you back into the changing area or the relaxation area.
You stay clothed, but you just wear a robe?
We have lockers that are
Okay.
there for the clients. We have robes and slippers in there for them. They'll change, they'll sit down. We have a nice relaxation area with couches. They can relax. We'll come out, greet them, bring them into the treatment room, which is...
What is the treatment room like?
What is it like?
Yes, so that people understand.
It's cozy and has nice ambiance and nice lighting, and it smells beautiful, and the bed is super comfortable, and warm.
So they lie down on the
They
bed,
lay down,
and you cover them up.
cover them under the
And
blankets.
then what normally will you do with them? You
The
move
first
back
thing I
their
will
hair,
do is I'll wrap their hair up
Okay.
and I'll analyze their skin.
Okay, and do you analyze that under a bright light?
We put little goggles on
Okay.
and we bring a magnified light over their face so we
Okay.
can take a better look at their skin, assess their skin, ask any questions.
And it doesn't hurt them. You're just
no, not at
looking
all.
at them.
Yep. We also have them fill out a questionnaire,
course.
medical history. We'll go over any questions that the client might have because I might see something that they don't see,
Right.
but that they are concerned with.
Okay.
So we'll assess the skin. We go into what we're going to be doing.
All right.
We'll cleanse, exfoliate with whatever modality we decide to exfoliate with,
Okay.
massage, products.
Massage related to the face.
Yep, we massage the face, neck, décolleté, hands and
The
arms.
décolleté is this area right here.
Yes, because that's part of it too.
Okay, yeah. And then the arms and the
The
hands.
hands and the arms.
Okay. And then you're giving treatment, though the treatment is focused on the face
The face and neck.
and the neck. And so it's not something that will hurt.
No.
It's something that will relax them
Yes,
and help to
absolutely.
nurture and nourish their skin.
Absolutely.
So how long does a skincare appointment take? A facial take?
It varies from 50 minutes to 75 minutes, depending on the treatment that we're performing that day.
So are there other treatments beyond the facial?
Yes? Oh, absolutely.
What are the other treatments that you do?
So we have our deep pore facials, which is more of a deep pore cleansing of the face or the body.
Okay.
And then we have more brightening treatments. We offer the Venus Freeze.
What is that?
The Venus Freeze is amazing. It is a radio frequency treatment that helps stimulate collagen production, tighten the elastin fibers, and
Is that
body
like
contouring.
electrical?
No, it does. No downtime. Does not hurt. And we have a handpiece that we go over the skin.
Okay.
It heats the skin up. It causes a thermal reaction in the tissue, which then creates a response where you get the fibroblast production.
What does that mean?
That's what creates collagen.
Okay.
So, and the elastin fibers, and helps contour the body for the body as well.
Okay.
That is our number one anti-aging treatment.
Really?
As of right now.
And can anybody avail themselves of that? Or
There are
certain
some
skin types
contraindications that
What are
you have.
they?
Contraindications would be somebody that maybe has a pacemaker, defibrillator, because we are working with the current. Even though it doesn't hurt, you won't feel a current. It's still working on the cellular level. So if somebody has a pacemaker or defibrillator, we wouldn't be able to perform the treatment.
See, doesn't hurt.
Not at all. It feels like a warm stone massage.
Okay.
It's great.
And then what happens when it's
So
done?
you have to do a series of treatments, anywhere from 6 to 8 for the face and neck, 8 to 10 for the body. You come in on a weekly basis. Once you have finished your series of treatments, you want to come in and you do one maintenance treatment every 3 months. So what happens is, while we're doing the treatments and up to 3 months after you have finished the series of treatments, your body is in that repair mode. Then you hit the 3-month mark, it starts to plateau. You want to come back in and put your body back into, jumpstart your body back into that repair mode again.
I see. So do people do a combination of facials and that?
Oh, yes. Yep.
And facials, there's no reason for people not to get it? Can anybody have a facial?
Pretty much anyone can have a facial. I mean, maybe if somebody had severe rosacea, but everybody would benefit from a facial of some sort.
Can you help people with rosacea?
Absolutely.
What are the things you can do for them?
Well, we would do a facial that's more calming, brings down any inflammation, and we would recommend home care to keep that inflammation. And also foods that you may eat, you want to avoid foods that, and this is for everybody, not just for people with rosacea. This is for acne, for anti-aging, avoiding foods that cause a lot of inflammation in the body.
What are those foods? What are the foods that cause a lot of inflammation in the body?
Well, it could be a lot of fried foods, junk food, things like that can cause a lot of inflammation.
Okay. So what would you recommend that people do to keep their skin healthy and well?
Come in and get regular treatments.
Okay.
Drink a lot of water. Wear your sunscreen.
And have a routine on your own
Absolutely.
daily care.
Skincare routine is so important.
And that's at least twice a day,
Morning
morning
and
and night. And that those treatments and what you do may be different. What you do in the morning may be different at night.
Yes, yep. So your skin at night, it goes into repair mode. So you want to maybe feed your skin with some things that are going to help that process along.
And do you do anything for the back if somebody was having a problem with the back or any other area of the body related to skin treatments to help?
Yep, we do back facials, body scrubs. Back facials are really nice because we're cleansing, analyzing. It's really nice if people are in the sun a lot. We can sometimes see things that maybe they're not able to see.
Okay.
We do a nice massage, scrub, exfoliation. It's really nice.
So if somebody was wearing or having a wedding or whatever else and going to be wearing a low back dress, that might be something that they might want to
Absolutely.
take a look at and do because people normally use a mirror to see what's happening back there.
Yes.
But there are scrubs that you can do.
Yes.
Are there any products that people can make on their own organically that can help them? Like sometimes you hear about people taking oatmeal and fresh products, organics.
I try to guide people away from that because it's not something that's really formulated for their skin. I would rather somebody use something that is really going to help whatever skin condition that they have with proven scientific results.
Yes. So you focus on skincare, and we've covered all those components.
Yes.
So we haven't missed anything that you would recommend for clients or
As far as
people.
skincare,
Is skincare.
well, we do lash extensions, makeup.
Okay, talk about the makeup a little bit. Just have a little time left, but talk about what you do as a makeup artist.
We are helping people look more beautiful.
Okay.
They're beautiful without makeup,
Right.
but we want to help enhance what they already have. So we might camouflage any spots that they maybe need camouflage or want camouflage, enhance certain areas.
So do you teach them how to apply makeup?
We do lessons, and we also have people come in for events, and we always do consultations for everything.
So why would somebody want a consultation for makeup?
Because maybe they're unsure of what colors are going to look good on them or how to use the makeup.
Okay. Are there things that you would recommend to people watching our program about makeup that they should be aware of? Because there's so many different types of makeups, like you had mentioned, related to skincare products. What should they be aware of related to their makeup?
Well, we carry Jane Airedale, and it's a mineral makeup line, which is, we look at it as an extension of your skincare. Everything in it is beneficial for your skin. There's products that have hyaluronic acid in it and CoQ10 and different ingredients that are going to help feed and nourish your skin. So I would definitely try and go towards a makeup line like that, something that has maybe a sunscreen in it. That would be the number one thing, is good. Makeup is great, but you want to have good skin, good healthy skin.
And in order to have good, healthy skin, what do you need to do?
You need to have a good skincare routine and have regular skin treatments.
As well as sunscreen.
Sunscreen. Number one thing is wear sunscreen.
Wear sunscreen.
Absolutely.
And the reason to wear sunscreen?
Anti-aging, free radicals, fine lines, wrinkles, cancer.
Exactly.
So
it's important to protect your skin and not really be out for a long period of time sunbathing in the sun and doing that, because that can truly create damage to the skin.
Absolutely.
But when you protect it, it helps. And also wearing hats
Yes.
and other garments that can protect
And a
your
vitamin
skin.
C serum.
So that vitamin C serum, you've mentioned it now twice. Why is that so important?
So particularly C&E ferulic, that this particular serum has won so many awards. It really is like the gold standard of serums.
Why is it?
Because not only does it have vitamin C, but it also has vitamin E and ferulic acid. So those are three antioxidants that when you combine them, synergistically they work even better and they almost accelerate each other. So they're going to fight free radical damage. They're going to help lighten pigmentation, help prevent more pigmentation from coming out. It's the only thing that's going to stimulate collagen. You get double the sun protection when you use it with your sunscreen. So it just kind of goes hand in hand with your sunscreen. Everybody should be on that.
So when do you put that vitamin C?
That would be the first thing that you would use just in the morning.
After cleansing?
After cleansing, you would put that serum on, let that absorb in for a minute or two, and then you can do any other serums, eye cream, moisturizer, sunscreen, finishing it off with that.
So you always finish off whatever your daily routine is of cleansing and makeup with sunscreen.
Nope, so your sunscreen, you're going to cleanse,
right?
Treat. You're going to then moisturize, sunscreen, and then your makeup.
Aha, so
Yes.
that's important. So the sunscreen goes on before the makeup goes on.
It's the last thing you put on as far as your skincare routine is concerned.
Related to cleansing
Yes.
and preparing the skin.
Preparing your skin
But
and treating
last thing before makeup.
Yes.
It's interesting because that's an important thing to note for
Yeah.
people. So just summarize, most important things to do, have a very good, healthy, schedule.
Skincare routine.
Skincare routine
Absolutely.
in the morning and in the night.
Yes.
And what do you want people to do?
I want them to cleanse, treat, wear sunscreen.
Moisturize, wear sunscreen.
And definitely wear your vitamin C serum. That is one of the best things that you can do. That with the sunscreen.
Okay, very important. Plus, you also said to eat healthy and well.
You want to eat healthy. You want to drink a lot of water.
Plenty of water. Obviously, get a good night's sleep.
Absolutely.
Get plenty of fresh air.
Yes.
And take excellent care of yourself.
Yes.
And how does one make an appointment for an esthetician?
You can reach me at Cassandra Salon and Spa at 603-888-3300.
And is it difficult to get an appointment?
It shouldn't be. If not with me, there will be somebody else available. We'll always try and fit somebody in.
So from your perspective, having a facial and taking care of your skin does what for people?
It makes them feel good. When you feel good, you look good. Or when you look good, you feel good.
Exactly.
And healthy and beautiful.
It makes you boost up and be as healthy as you possibly can. It's a pleasure to have you. Thank you very much. Until next time.